so I think we pretty much have everything.
All right, Mr. Shepard, that wraps up your health history interview. If you'd like to get changed into a gown, we'll be back for your head-to-toe assessment.
Sure, sounds good.
Okay. Now, my student Anna will actually perform the assessment, and I'll be here to observe, all right?
Oh, that's not a problem.
Okay. Well, you get changed, and we'll be back when you're ready.
Okay.
Thank you. Feeling okay? Ready to go?
Just a little bit nervous. I've only seen the head-to-toe assessment in bits and pieces, so this is my first real go-through.
Well, don't be nervous. I'll help guide you through it.
I'm just afraid I might forget something.
Everybody feels that way at the beginning, but you'll get comfortable, so don't worry. Now, there's no one right way to integrate the entire physical exam. You just have to get into a routine that works for you.
I'm just afraid if I go through everything, I'll have the patient in there for 4 hours.
Well, not everything has to be done individually. You'll find you can combine some of your body system assessments.
How?
Well, let's say when you're assessing legs, you're examining the parts of the skin, the color and condition of the legs, and at the same time you can be assessing the peripheral vascular system, the pulses, the color, edema, lesions of the legs, right?
Mm-hmm.
And at the same time you're looking at the musculoskeletal system, assessing movement and strength.
Oh, okay, so I don't have to go through every system individually on its own from head to toe.
Not at all. The procedure takes time, but shouldn't be unreasonable.
Whew, good.
Also, if you missed anything in the health history, it's okay to ask about it during the physical exam.
Okay, so if I'm assessing the heart, then I can ask the patient if he's had any chest pain recently.
Exactly. Okay, let's go over what we know so far. What did we see in our initial assessment?
Well, the patient's in for a routine checkup. I did the interview, and I didn't find anything abnormal with his past health history, family history, lifestyle, and health practices.
Did he have any specific health concerns?
None that he brought up during the interview. If he had, I would have asked questions that were focusing on that.
Right. Now, you can also tailor your physical assessment to that concern.
Okay.
So what about the general survey? What were your findings?
Nothing abnormal there either. His grooming was good, physique, hygiene, all normal. Vital signs were within normal limits, temperature, pulse, respiration, blood pressure, and so were his height and weight.
Okay. Now, what if he had sought attention for pain?
Well, I would have treated that as the fifth vital sign and then asked questions that related to his pain, like the intensity, location.
Look at you, doing good. Okay, what about Mr. Shepard's mental status? Do you think he looked alert and oriented?
Mm-hmm. He answered all my questions appropriately. Facial expressions were normal. Speech pattern was normal. He cooperated, and it was fine.
Great. Mental status is also part of the neuro exam, so you've already started that part. Now, if you'd seen anything abnormal, like inappropriate behavior, bizarre speech, confusion, a change in mood, or head trauma, then we would have performed a full mental status exam.
Okay.
All right, well, Mr. Shepard should be ready to go, so relax, Anna. You know your stuff.
Okay.
Let's go.
Okay. Mr. Shepard?
Come in.
Hello?
Hello.
Okay, so as we said before, I'm going to be doing a head-to-toe assessment, starting from the top and working my way down. And we'll only expose one area as we assess it. I'll ask you to change positions, sit, stand, turn this way or that. And if there's anything that's uncomfortable, you let me know. Okay?
You look at everything.
Mm-hmm.
That sounds pretty serious.
We prefer to think thorough. We want to make sure we get all the information accurate and that we don't miss anything.
Okay, then. I can respect that.
All right, now I'll be talking Anna through it, and we'll be going one section at a time, so don't mind us, okay?
Sure. Hey, I might learn something today.
You just might.
Okay, so let's get started. You can just sit up and have your shoulders back, and then just hold your head straight and still. Okay, so the first thing I do is check the size and shape of the head. And then I checked for distribution, color, and consistency of the hair. Okay, and then I move on to the face.
What are we looking for here?
Facial expressions, any rashes, lesions, symmetry. All right, now I want to test cranial nerve 7. So if you can just smile. Okay, show me your teeth. Okay, good. Blow out your cheeks. Okay, and raise your eyebrows. Okay, and then close your eyes really tight. Okay.
Okay,
that's good.
Now you want to test for sensations. This is cranial nerve 5.
Okay.
Mr. Shepard, I'm just going to ask you to close your eyes, and Anna's going to lightly touch your face, and I want you to tell us where you feel it, okay?
Okay. On my left cheek, forehead, chin.
Good. Now you can open your eyes. Anna, now you'll palpate the temporal artery, which is located between the top of the ear and the eye.
Okay. How's that feel?
Fine.
What are the normal findings, Anna?
Well, the temporal arteries should be non-tender and elastic.
Good. All right, now to the eyes. Okay, you recently had a vision test and a fundoscopic exam, right?
That's right, about 2 weeks ago. Everything checked out fine.
Great. Then we'll go right to inspecting the external eye. You'll look for abnormalities with the eyelashes, the eyelids, and the overall position of the eyes.
Okay, just look at me. All right, Mr. Shepard, now I'd like to check you for pupillary reaction to light.
I'll dim the lights, okay?
Okay. So if you can just focus on the poster there. All right, just hold still. Okay. Each pupil got smaller.
And there we go. The normal response is constriction.
Okay. Let's see. What's next?
We test the accommodation of pupils.
Okay.
What's that?
This is a test where you focus on a distant point to a near point. So you're going to hold that about 12 inches away. Just focus on the pencil, Mr. Shepard. And now Anna's going to move it forward.
Okay. Again, constriction of the pupils and convergence of the eyes.
Now to the ears. We start at the auricle, the tragus, and lobule. And what are we looking for?
Well, we're looking for smooth skin, any lumps or lesions, and to make sure that the color of the skin is consistent with the facial color.
Right.
Okay, and then I palpate the auricle. And then I check the mastoid process for tenderness. Does that feel okay?
Yes.
Have you noticed any changes in your hearing recently? Anything like having to turn up the volume of the television or something?
No, no problems. No changes from the usual, no.
Okay, good. Well, just remember that if you have any changes in your hearing or speech, be sure to schedule a hearing test, okay? Now for the nose. We're going to start with the external. You're looking for color, shape, and consistency. And you'll want to palpate the external nose for tenderness.
Okay. Is any of that tender?
No.
Oh, okay. Now I'd like to check patency of airflow through the nostrils. So can you take one finger and hold your nose one side and then take a deep sniff in? Okay, and the other one? Okay, good.
Have you had any problems with your sense of smell?
Not at all.
Okay. Now, if the patient's here about a concern with his nose or sinuses, you would inspect the internal nose. You would also palpate the sinuses and transilluminate the sinuses with a pen light to check for fluid or secretions.
Okay.
Moving to the mouth. Let me get some gloves for you, Anna.
All right.
You want to make sure you have a tongue depressor and a pen light.
Okay, I've got that.
Okay, what are we looking for?
Well, we're checking the lips for color, consistency, and any lesions. And can you open your mouth so I can see your teeth? Okay.
Be sure to note the number and condition of the teeth, and also inspect the gums and buccal mucosa for unusual color, consistency, or lesions.
Okay, so just open your mouth. Okay, say ah.
Ah.
Okay. The rise of the uvula is normal.
Okay. Now you want to test the gag reflex. This tests cranial nerves 9 and 10.
All right, so Mr. Shepard, I'm going to touch your soft palate, okay?
I hate this part.
Just take just a second.
No, not a problem.
Okay, so open up. Stick your tongue out a little bit. Okay.